Good morning everybody. I am Dr. Gopika Rajesh, consulting obstetrician and gynaecologist, laparoscopic surgeon and infertility specialist from MULTI Speciality Hospital. Today's topic is about fibroids. As you all know, fibroids are benign tumors that arise from the uterus. This happens somewhere between 28 to 45-50 years of age in any woman. These fibroids are estrogen dependent benign tumors. That means they don't have a potential to become malignant until and unless in 1% of individuals where there is a chance of it getting into fibrosarcoma. There are many locations where the fibroids occur on the uterus. So if the fibroids are occurring outside the uterus, then they are called as subserous fibroids. If the fibroids are arising within the uterine muscle, then it is called intramural fibroids. If the fibroids are arising within the cavity of the uterus, then they are called as submucous fibroids. Then why are these fibroids so important in a woman? Because the fibroids can cause very severe pain, especially during menstruation. The first thing. The second thing is they are known to cause menstruation which is very heavy. It is called menorrhagia. Sometimes this menorrhagia can go up to 8 days, 10 days and 12 days, and especially in case of a submucous fibroid, there can be continuous spotting for almost 25 to 30 days associated with pain. If every month a woman is bleeding heavily for about 7 to 10 days, this can lead to anemia. Sometimes these fibroids in a woman of reproductive age group can cause very severe dysmenorrhea. What do you mean by dysmenorrhea? Dysmenorrhea means pain during sex. Then coming into the size of the fibroids, these fibroids can range from anywhere between 1.5 to 2 centimeters up to 15 to 20 centimeters in a woman. Suppose the fibroid exceeds about 8 to 10 centimeters in size, then they can be felt per abdomen and the patient complains of some heaviness in the lower abdomen. How do you diagnose these fibroids? First thing is depending upon the symptoms, and second thing is the routinely by doing an ultrasound. On a regular ultrasound, you can locate the size, the position and any pressure symptoms that are associated with the fibroids. The position of the fibroids will say whether these are the reason for the symptoms of the patients. Especially in the reproductive age group, if the fibroid is located within the endometrial cavity, that is within the cavity of the uterus where the baby is going to get implanted, then this can lead to problems with infertility. Sometimes the ultrasound also can't differentiate between just a mass that is arising from the uterus, which is called the fibroid, or routine enlargement of the uterus, what we call as adenomyosis. Then in such cases, if we want to know the proper diagnosis, then we suggest them to undergo an MRI scan. Then how do you treat the fibroids? Are there any medicines to cure the fibroids? There are two ways of treating fibroids. One thing is if fertility is desired, which means if the patient wants to bear future children, then we do something called myomectomy, which means we just remove the fibroids which are on the way for reproduction not to happen, which are hindering the way to reproduction. That means we just remove the fibroid from the uterine muscle and then we suture the uterine muscle like what we do in cesarean section, which can be done by two ways. One is by laparoscopy, wherein we make small holes on the abdomen of the patient and we remove the fibroids by morcellation. That means we break down the fibroids into multiple small pieces and then we remove it through laparoscopy. It's a very small procedure. Though myomectomy is a major surgery, it can be done in a minor way through laparoscopy, wherein the duration of the stay of the patient is only 1 to 2 days and the patient can resume to normal activity from 3rd or 4th day itself. The second is to do hysterectomy. Hysterectomy also can be done in two ways. One is through the traditional cesarean section kind of incision where we do it abdominally, and then the second way is through removing it by laparoscopic method. Nowadays, the laparoscopic method is gaining acceptance because the patient can return back to normal activities as early as possible. Then coming into the medical methods of there is one more method wherein you can remove the submucous fibroid. I have already mentioned that if the fibroid is arising within the endometrial cavity where the baby is going to form, it is going to disturb and it is going to cause infertility. Suppose say there is only one fibroid which is present in the submucous location, then we can do something called hysteroscopic myomectomy, wherein there is no cut on the abdomen of the patient. We pass a small scope through the vagina and cervix and check the location of the submucous fibroid and remove it. This is called hysteroscopic myomectomy. Then coming into the medical management of fibroids. See, the medical management of fibroids is only very temporary method. Temporary in the sense, if you want to shrink the size of the fibroids so that the blood loss during the surgery is less, or if you want to see to that the patient can gain some time before she can take a decision for hysterectomy, then the medical management can be done. It can be done up to 6 months. And there is one more way of treating the fibroids medically, which is called Mirena insertion. Mirena is something like a copper T which is inserted to a perimenopausal woman, which means the patient is going to attain menopause in another 3-4 years, but there are few small fibroids which are creating trouble. Then we do a DNC, then check the biopsy report and then insert Mirena so that the fibroids can shrink till the patient attains menopause and get complete relief from fibroids. Thank you.